all about visiting an out-of-network provider. To help you budget your finances, it's good to understand how your medical benefits work. You have the freedom to see any doctor you wish. But what happens if you visit a provider who's outside your network? Most times, when going out of network, you'll wind up paying more for your healthcare services. Why is that? If your doctor isn't in the network of providers included in your healthcare plan, they have not agreed to a contracted network rate. Since contracted rates allow for savings on the cost of healthcare, going outside your network will usually result in a higher bill for services. Your benefits plan may allow for a discount on out-of-network services, but you'll likely still owe a larger portion of the overall cost, i.e. your coinsurance, with a higher deductible. Or possibly, the care you receive at an out-of-network provider will not be covered by your plan at all. This means you'll owe the full amount of billed charges without a discount, and it will not apply to any deductibles or out-of-pocket costs. You might find this to be true, especially when receiving preventive care, since out-of-network providers don't need to follow the healthcare reform rule mandating these services get covered at 100%. Out-of-network exceptions. There are exceptions where out-of-network providers may be paid at the in-network benefit level. For example, you could find yourself in certain situations where you don't get to choose which provider you'll see and end up being treated by an out-of-network provider. For instance, you could go to the emergency room for a life-threatening condition and be treated by an on-call doctor. Or another situation could be that you have surgery done by an in-network surgeon at an in-network facility, but the anesthesiologist, who you don't get to choose, is out of network. In cases like these, your benefits will typically be covered at the in-network benefit level, but you should always check your plan to make sure. However, since the providers are out of network, they do not have to accept the allowed amount on the claim. The allowed amount is typically how much the insurance says is reasonable for the service, based on data for your area and for that service. Other times, it may be a negotiated rate, where the provider agreed with the insurance via a negotiation on an allowed amount for a claim. In the case it was a negotiation, the provider would need to accept the allowed amount. But remember, if it was not negotiated, then the provider does not need to accept it. Therefore, if a provider billed $200 for a service and the allowed was $150, the provider could bill you for the full $200, which includes the $50 difference of what they billed versus what the allowable was. This is called balance billing. Furthermore, only the $150 would apply towards your benefits, and you are still responsible for the $50 difference in addition. If you do get billed for this amount, call your provider and see if they are willing to work with you on the bill given the circumstances. Ultimately, it is up to the provider since they are out of network and there is no contract. How do you find network providers? So all of this may have you wondering how you can find in-network providers and set your mind and wallet at ease. You can simply check your benefits information for a provider listing or log into your member portal by visiting www.meritain.com. If you still feel stuck or need more help, you can also contact Meritain Health Customer Service by calling the number on the back of your member ID card. We're always here to answer any questions you may have.